Good afternoon, everyone, and welcome to the Substance Abuse and Mental Health Services Administration's Learning Series, Communities Talk About. Today's session will be recorded. Please mute your lines when you're not speaking and feel free to continue to utilize the chat throughout the call. We will be monitoring the chat, so if you have any questions for our panelists, please write them in the chat at any time. The recorded session of this presentation will be posted on our website for on-demand viewing starting in January. My name is Marion Pierce. I'm a public health analyst in the Center for Substance Abuse Prevention at SAMHSA. I'm also the lead for the Substance Use Disorder Prevention Engagement Initiative, or SUD-PEI. Please join me in welcoming our other speakers. Denise Dixon is from the SUD-PEI team, and Van Wilson is with the Prevention Technology Transfer Center Network Coordination Office. I'd like to invite our speakers to tell us a little bit about themselves and the work they do. Denise, please start us off.
Sure, Marion, thank you, and good afternoon, everyone. My name is Denise Dixon, and as Marion said, I am the Technical Assistance Lead for the Communities Talk to prevent alcohol and other drug misuse. I've been in this role for the past 4 years, and I'm tasked to just ensure organizations like yourself has a smooth process throughout the Communities Talk cycle. So I kind of help with the registration process. I help track your stipends once your registration is completed, and I assist with the development and the posting of success stories and the podcast. And since my team and I are kind of the ones who monitor the info mailbox on a daily basis, you can say I serve as a liaison between you and the SAMHSA team. Thanks, Marion.
Great. Thank you, Denise. Van?
Thanks, Marion. Hello again, and welcome, everybody. My name is Van Wilson. I'm the project coordinator for SAMHSA's Prevention Technology Transfer Center Network, or the PTTC Network, as I'm sure you've heard us called. I work for the Network Coordinating Office, and I'm based out of the University of Missouri, Kansas City, in Missouri. And first, just a huge thank you to Marion for the invitation to highlight the PTTC network during our session today. I'm always so excited to talk about the huge wealth of free support and products that we have provided and continue to provide to those who work in and around our substance misuse prevention world. So again, thanks, Marion. And I'm happy to share about the PTTC network here in just a little bit.
Great. Thank you, Van. And actually, thank you both for being here. Also, I would just like to say thank you for the warm greetings that we're getting as I'm looking at the chat box. I need to focus on this session, but I'm feeling so great about all of the hellos from across the country and knowing that there's great interest in this topic. So with that in mind, we'll talk about some learning objectives. So in this discussion, we hope you'll learn more about the Communities Talk 2023 cycle, the new Communities Talk prevention resources and activities, how to use Communities Talk as a resource to establish and rejuvenate community partnerships, community-based prevention resources and strategies from the PTC network. And after that, you'll be able to ask us any questions that you may have about Communities Talk. Next slide, please. So some of you may already know this, but we always like to include this slide. Communities Talk is a program run by SAMHSA to support community-based organizations, institutions of higher education, and statewide or state-based organizations in holding prevention events or activities. These events raise awareness and educate communities about the harmful consequences of underage and problem drinking in youth and young adults. And it also encourages communities to mobilize to take evidence-based prevention actions. Next slide, please. When Communities Talk began, we provided community-based organizations, or CBOs, and institution of higher ed, or IHEs, and statewide state-based organizations with $500 stipends to support their prevention activities. So to better support communities in their prevention activities, since 2021, Communities Talk has been able to offer $750 stipends and will continue to do so in the 2023 cycle. Now, actually, next slide, please. Let's see. Yeah, registration for the 2023 cycle opens on January 3rd, 2023. There are only 500 stipends of $750 each. So CBOs and colleges and universities need to act quickly as the stipends are on a first come, first served basis. Communities Talk has evolved and will now take place every year, excuse me, starting with this next cycle in 2023, which is really exciting for me. We hope that this change will help communities carry the momentum in their prevention efforts from year to year. We encourage organizations to continue their prevention work, even if they do not receive a stipend. And we know that Communities Talk has also expanded to now include conversations about substance misuse and prevention of substance use disorders, as opposed to mainly focusing on underage drinking as we've done in previous years. So at this time, I'm just gonna segue over to Denise to give us some more information, and then I'll come back to you. Denise?
Thanks again, Marion. Next slide, please. Okay, so how you can participate in the Communities Talk. We are encourage organizations to start thinking about their 2023 Communities Talk activity from now. As Marion shared, the registration opens the first week of January 3rd to be exact. And once you receive your invitation to register, I would suggest that you complete your registration as soon as possible because stipends are limited. If you have participated or registered for the 2021 cycle, you will be invited for 2023. If this is your first time requesting an invitation, or you haven't participated in last year's cycle, so you probably participated in 2019 or 2016 and previous years, please email the info@stopalcoholabuse.net so our TA team can verify your organization to be included on the 2023 invites. And again, I'm going to ask our moderator or our host to please just put the email address in the chat for you all. And again, that's info@stopalcoholabuse.net. And we will then verify your organization to make sure that you can be included with the 2023 invites. So over the next couple of weeks, we are going to encourage you, again, start planning from now. You can start thinking about your planning team or your committee. Please try to obtain your organization's 2018 W-9. That is the latest W-9, which was issued by IRS. And then start thinking about your prevention activity that you may want to conduct. It is important that you let us know that your activity, it's important that I should let you know that your activity must take place by November 30th of 2023. Many organizations may incorporate Communities Talk activities with other events such as Alcohol Awareness Month in April, National Prevention Week in May, Red Ribbon Week in October. We have high school prom, summer vacation. So again, there are an array of observances that you can look at to host your Communities Talk activity. Can we go back to the previous slide, please? Thank you. Okay, so now we want to get started, right? So when you get your invitation in January, again, you're going to look for that email. You are going to be assigned a unique URL. That URL is specifically for your organization. You cannot share that with anyone else because it is specifically tied to your email address. Once you enter your registration form, there are going to be 4 steps for you to complete. So we don't have those steps here on the screen, but I'm just going to let you know ahead of time. So again, so you could be prepared in January. So step 1 is just going to be basic information about yourself, the contact person who is going to be coordinating the activity. We're going to also ask you in step 2, information about your organization. Step 3, there is a question if you're going to be requesting a stipend. We do understand that some organizations may not request a stipend, yet they want to let us know that they're hosting a communities talk activity nonetheless. We want to know that. So that question is there under step 3. When you have your W-9, it is important that you have your federal identification number for your organization. Please do not send your social security number. We do not want that, and we cannot process that. So the W-9 must be specifically tied to your organization and your organization's federal identification number. In step 4, we're going to ask you a little bit about your activity. So again, it's time for you to start planning now. We want to know the geographical setting of your activity. We want to know your activity type, whether it's going to be in person, it could be a virtual event. We have seen organizations do a billboard campaign. So there are so many things that you can do for your communities talk activity. One of the things that we are going to ask, one of the questions we will ask is whether or not your activity is led by youth. We have seen an increase with a lot of organizations or activities being led by youth, and that question is actually new to this year's registration form. So now you have registered, you completed your activity details, and then you will get an email. If your W-9 was submitted correctly, you will get an email from our team saying that your W-9 was reviewed and it has been approved and your check should be on the way. Typically, your check should arrive within 21 days after we reviewed your W-9 and it is approved. And then once you receive your check, please cash it right away because it will be voided after 60 days. So we ask that once you get your check, please cash it right away. We do understand sometimes the checks may not go to you directly. It may go to your accounting department. Just give them a heads up. Let them be on the lookout because again, as soon as they get that check, we want you to cash it right away. And once your activity is complete, we want you to share your success. Success has no limit. It can be as small as a group gathering to having thousands of folks at a festival. We have seen and we have heard so many different success stories shared from the field around communities talk prevention. Next slide, please. So again, just a few things to look out for. Look out for your email. The email invitation will be sent the first week of January. It's going to be coming from the info@Stop Alcohol Abuse mailbox. Again, complete your online registration as soon as possible. There are many questions and answers on our website. So if you have any questions, feel free to go to our website and look what we have there as answers. If not, again, you can email the info mailbox. We check it daily, and we can definitely answer your questions that way as well. The graphic that you saw on the previous slide, it is a 3-step diagram, and that will also be sent out with your invitation as well. So don't worry, we have you covered. Next slide, please. And is this me, Marion, or is this you? I think this is you. I think I'm going to toss it back over to you, Marion. I do apologize.
Right.
Yeah, no
Thanks,
problem.
Denise.
You're welcome.
So SAMHSA has been working hard to update and release new resources, including an updated Quick Start Planning Guide and the new Event Planning web app. The Quick Start Planning Guide will help you and your team to efficiently yes, thank you. The Quick Start Planning Guide will help you and your team to work efficiently and seamlessly as you navigate the planning prevention activities through checklists, a calendar, and detailed steps. The Event Planning Guide offers a variety of resources to help you plan your event, such as task lists and the ability to plan multiple events at once. And these resources will help you in achieving measurable outcomes in your community. Next slide, please. So further resources are available at stopalcoholabuse.gov. I would suggest you go under the Research and Resources tab. There you'll find resources and information about evidence-based prevention strategies related to underage and harmful drinking. These resources provide an overview of prevention approaches that are available to communities and about their effectiveness. Excuse me. Next slide, please. Oh, the podcast series. So please tune into SAMHSA's new podcast series to learn how recipients are advancing substance use prevention in their communities. Each episode of Communities Talk About Prevention features participants from the previous Communities Talk cycles discussing how they coordinated local events and activities to support substance use prevention, how they overcame unique challenges, and how they measured success, which is very important. Guests also shared their best practices, which we hope will inspire your prevention efforts in your own community. Episodes 2 and 3 are available on the Communities Talk website and other podcast hosting platforms for listening now. The third episode will be available in January, and I saw a pop-up question of the Communities Talk podcast are different from the Talk They Hear You podcast. Next slide, please. Yes. Alcohol misuse in youth and young adults is still a core tenet of Communities Talk. And as such, SAMHSA has released a new alcohol policy guide to serve a compendium of key policies for prevention efforts nationwide. We encourage you to check out this resource to learn more about the evidence-based strategies. And I think we missed a slide. Actually, let's go to slide 19 if you don't, if you can go there. Okay, I'll just close this one by saying we have a new guide for reviewing evidence related to utilizing community engagement to support evidence-based programs and policies. This guide provides an overview of how community engagement can be in the uptake of evidence-based programs in communities and beyond. And with that point, I will segue over to Van with the PTTCs to talk about some other resources. Van?
Thank you so much, Marion. Again, hello and welcome. I think we're miraculously a little ahead of time here. So if there's any topics that we want to come back to, I'll let my fellow presenters decide that here while I tell you about the PTTC. So just again, a huge thank you to Marion for the invitation to allow us to come to talk about our network. As I understand, of the 525 people that we have joining us today, which is just very exciting to me that like there's 500 people out there that are as interested in these topics as I am. Sometimes you feel out there on an island. To come and talk to many of you who I understand are doing prevention, are doing the work. And I'm hopeful that a majority of you have already heard and have used the PTTC network to enhance your substance misuse prevention work. So our network, the PTTC network, it's a SAMHSA-funded training and technical assistance center. We launched in 2018 following the successful model of the Addiction Technology Transfer Center Network, which is approaching 30 years, believe it or not, in existence. We also launched at the same time as the Mental Health TTC and are collectively known as the TTC Network, each with our own focus on part of the continuum of care. So our purpose, obviously, is to improve the implementation and delivery of effective substance misuse or use prevention interventions. And we do that by providing training and technical assistance. Next slide, please. So as I just mentioned, we develop and disseminate tools and strategies to improve your efforts. We do a bit of intensive TA as well, focused on prevention science, the application of the science and epidemiology in prevention work, and a lot around selecting and implementing evidence-based and promising prevention practices. And lastly, we do a lot of work on building the components of and elevating the prevention workforce. So just a few bullet points on some of the projects that we have been involved in or have led in the last few years. We've pursued a federal job classification for prevention specialists with partners. We do a lot of work on supporting prevention specialist certification. We just published a map where you can go in and click on your state and learn about all of the certification requirements that you, the criteria for your particular state for getting your prevention specialist certification. We have improved and to our best ability proliferate the required prevention specialist curriculum like the THAPS and prevention ethics. I'll just have a quick aside here. I work pretty closely on our prevention ethics course. It's extremely popular. I apologize if we haven't answered your emails on this, but we do our best. It sells out, it fills up in about a half hour most times or so. And then finally, the network brings leadership and I would say focus to the work with our broad coalition of partners as we work together to kind of build and elevate the substance misuse prevention field and attract that new generation of preventionists into the field. Next slide, please. So in the same way that the ATTC network uses the Health and Human Services regions, the PTTC network and the MH Mental Health TTC network mirrors that as well. So we have 13 centers total across the United States. We have 10 in each of the HHS regions. And then we have 2 what we call our population-based centers. So one focused on working with our National American Indian Alaska Native partners, and then one with our National Hispanic and Latino partners. And then we count ourselves amongst that as well, myself amongst that as well with the network coordinating office. Next slide, please. And this is just a very small and hard to read map, but hopefully you can pick out your state here. I'll quickly, well, here, I'll give you a second. I'll give you 5 seconds to pick out your state here. And you can kind of see which region you might be in. But I'm going to quickly move to the next slide and put our URL to our website in the chat a couple times here. If you go to our website, you'll see there on the top left, you can select your PTTC. You can also view the map that we just looked at there. So if you want to get, I'd encourage you to connect with your regional PTTC or the population-based PTTCs to learn more about what might be going on in your region. But as a whole, the PTTC network offers everything to everyone of sorts with the regional focus and population-based focus centers. Next slide. When the network was established, we took stock of what we all were very good at and what we wanted to prioritize in our 5-year cycle. We are in the last year now of our 5-year cycle, preparing for a potential FOA someday. We developed 6 working groups based on the expertise and interests that existed across the field. And so those are the 6 that you see listed here. I will put this URL into the chat, and you can take a look at each one of these working groups. They've each done, I would say, cutting edge work in their areas, and there's a lot that I could say about each one of them. And I just want to quickly say thank you so much for all of the shout outs in the chat. I'm always amazed at how, oh, thank you. You're not seeing them in the chat because I'm sending them to the hosts and panelists. Here you go, everybody. I'm always amazed at, but not surprised, amazed but not surprised at the reception that the PTTCs have had nationally. We do employ, I would say, some of the world's best preventionists, and I think our resources are a reflection of that. So that's exciting. Thank you all for that in the chat. One of the working groups, sorry, next slide. One of the working groups that I'll focus on particularly because, as I understand it, I hope many of us or many of you in attendance today are doing the work. You're working in communities, you're collaborating, you're perhaps leading or on a coalition. So this is our Community Collaborators and Coalitions working group. And I've just highlighted just 3 of the resources, and each one of these is a wealth of information. You can see the first one that we worked a lot on was the 6 elements of effective coalitions resource toolkit. This spanned a couple years, and we have in-depth sessions on each one of these elements. They've hosted a bunch of advanced ethics webinars. I want to say 6 or more even now. And then just recently, as harm reduction has become part of our conversation and prevention, this is our group that has attempted to understand that, really get in front of the narrative and attempt to understand how harm reduction and prevention work together within communities. So definitely check that out there, a part 1 and a part 2, and I'll make sure that those links get to you. But I'm keeping an eye on my web analytics, and I had a huge spike in web traffic just a minute ago, which is great. So 85 people or more went to the website. You can find these under the focus areas that I just put in the chat just a moment ago. Okay, next slide. We have, I want to say 1,400 and counting, 1,300 and counting resources that we've developed over the last 5 years. These are 4 more of our resources that I thought might be particularly valuable to this group, thinking within the framework of the strategic prevention framework. As you see there, the steps reflected there in the very familiar graphic on the right. So we've done a lot of work on making sure that our decisions, our prevention decisions, are informed by data, and you can check those out there. Building capacity for local data collection, I thought might be some good resources for this group because of the connection with alcohol. Just one of our recent webinars around the context of alcohol, the history, the culture, what it means for prevention. And then finally, if you're on our mailing list, you'll know that the Alcohol Awareness Toolkit continues to be one of our most popular products. This is a product from Region 10, Northwest PTTC, and they update it every year. And it's a lot of really practical tools for coalitions to use to communicate about alcohol, to increase awareness. So they have social media kits, they have email blast kits, event kits, and the whole 9 yards. But instead of feeding you something today, next slide, I'm going to teach you how to feed yourself. So again, going back to our website, and I'll put it here in the chat again, pttcnetwork.org. In the middle of our page, you'll see our resources tab. And then you see that big orange arrow there, it's pointing to our product and resource catalog. I always like to take a minute and just teach people how to use this because this will be your main entry point into the PTTCs. 3 years into this job now, I often find that some of the hardest things for our consumers is just finding the right resource because we have so many amazing resources. This will help you. This is one place to start. You can kind of see there, although it's a little blurry, you can just search for free text. We have, I want to say, about 40 or 50 keywords that you can also search by. And if you're interested in something from a particular center or a particular type of tool, like a toolkit or a recorded webinar or a brochure, you can search by all of these data points. So again, I would encourage you to do that. That's one of our evergreen spots. It's always going to be there. Come back to our product and resource catalog, please and thank you. Next slide. Lastly, I will encourage you to, if you're not already, subscribe to our monthly PTTC post. It's our prevention newsletter. We have a topical feature article each month. And then we're highlighting a number of the PTTC resources. We try to make them as topical and timely as we can and keep it interesting for folks. So please encourage you to join our PTTC post there. You can see our general email address right there, networkoffice@pttcnetwork.org is a good way. That comes to myself and a number of colleagues. And then follow us on social media. We have some really great staff here internally that help promote and cross-promote, you name it. We do a lot of work with SAMHSA and obviously our partners across the TTC network to promote our stuff. If you have good prevention stuff that you want to get out there or need to get out there in your region, we'll happily consider those for cross-promotion there on all of our platforms, not just our social platforms. So we're active on Twitter and on Facebook. And let's see, I think that's about all I have. Again, just a big thank you to Marion for the opportunity to come talk to you all today. And I'm handing it back to Marion, but first, just a happy holidays. And I hope everyone stays healthy as you go and potentially visit new people over the holidays. So thanks again. Handing it back to you, Marion.
Great. Thanks much, Van. Before we go into any questions and answers, I think we skipped maybe 3 slides. And Denise, if possible, can we go back to slide 12 and discuss those? Maybe that will answer some of the questions that we've seen pop up.
Absolutely, Marian. Thanks. And thanks, Van, for that information as well in regards to the PTTC network. And so for this slide, we're going to kind of dive in a little bit around community partnerships. one thing that we have noticed is that through communities talk activities, a lot of partnerships has been fostered, whether it's between the IHEs, which is the Institutes of Higher Ed, and let's say a local nonprofit organization, or a local nonprofit organization and a national nonprofit organization. And so if you go to our website and you have a tab that's called Find an Activity, you can go on this tab and you can see the different communities talk activities that happens across the United States, including their territories. It's our territories. So Puerto Rico and Guam and so forth, everything is kind of highlighted here on this map. Once a CBO or IHE upload their activity details, we typically approve them within like a couple of days, and then it will appear on this map. This map, again, is updated throughout the year. If you want to go back to previous cycles, let's say 2021, 2019, you can see all the different activity that has transpired in the past. So a lot of organization has used this map as a tool to kind of create new relationship, kind of gain ideas on different prevention activity that has happened in their area and what they want to do going forward. So I would definitely suggest utilizing this activity map for the 2023 cycle. Next slide, please. Thank you. And success stories. One thing that, again, we have mentioned is that success stories can look in any type of a way, from a small town hall meeting to, again, a billboard that has been placed throughout the city or community or the state. One of the things is when you complete your communities talk activity, I ask that you email us right away and ask for your success story questionnaire. We will then send you that questionnaire, and then you will complete it. We will then review it, and we compile a list of stories under our success stories tab here on our website. If not, if you don't email us right away, within around springtime, you will see an email from me and my team or my team and I to just kind of say, hey, we would like for you to share your success story. These stories are very important for the SAMHSA team to kind of look at and to share with the public as far as what is going on around prevention activities across the United States. A couple of our stories has also been featured on our new Communities Talk podcast as well. So we definitely would like for you to share any and all results from your Communities Talk activity, even if you had used the PTTC resource and the data collection tool and so forth. We want to hear about that, and we would like to share that story with others. Next slide, please. And before we go into Q&A, I would like to just leave you with this quote. This is an actual quote that we received from a community-based organization that basically talks about what the Communities Talk initiative has done for them and why this is important for us to just continue prevention efforts going forward. So I'm going to leave you with that. And I'm going to toss that back over to you, Marion.
Great. Thank you, Denise. So now is where we go into the Q&A section of the webinar. Let's see. I would like to ask Denise 2 questions, and then I have one for Van. And while you two are working on that, I will see what else is in the chat. So Denise, one question that I saw was, how do we ensure that we will receive an invitation email to apply for a stipend?
Great question, Marion. So if you do not receive an invitation, let's say by mid-January, please again email us at info@stopalcoholabuse.net. Every single email that we have received for a request for an invitation, we will respond. If you do not receive a response from us to say thank you for your request, please again, just email us again, but you will receive an email just to acknowledge your request, and then you can look out for the invitation in January. We will also send out an announcement through our Communities Talk What's New e-alert, and under the What's New tab as well, that is on our Communities Talk website. So we will then also place it there to say invitation has been sent out. Look out for your invitation.
Follow-up question to that, Denise, from Donette. How do you register?
Thanks. So once you receive your invitation, within your invitation, there will be a unique URL link, and it will be linked directly to your profile. Once you click on that link, there will be a profile form for you to just answer a series of questions. There's 4 steps with a series of questions for you to answer. If everything is done correctly, including you uploading the correct W-9, again, the 2018 W-9 from IRS. Once that is uploaded, you will receive an email from us to say it has been reviewed and approved, and your stipend is on the way, and the stipend will take around 21 days for it to reach you.
Great. And let's see. Question for you, Van. I saw there was a question about fentanyl. I know that if you go to the SAMHSA website and click under topics and insert fentanyl, you will see a list of all of the SAMHSA products that are there. I think my former colleague and great person, Rich Lucy at the DEA may be on this call, and of course the Drug Enforcement Administration, or DEA, has information on that topic. Also, the National Institute on Drug Abuse would have information as well. And Van, I'll toss it over to you, because I'm quite sure there are many things on the PTT site that discusses fentanyl.
Absolutely, yeah. I was just pulling up, again, I'll point people towards our product and resource catalog. So one of our keywords is fentanyl. And I was just looking there. We have a little bit on the topic. It looks like we have about 6 products. There's a fentanyl test strip training, enhancing prevention services to LGBTQ individuals and populations. So kind of focused on the opioid epidemic and fentanyl specifically there I'm seeing in this issue. So yes, it does look like we have a number of topics. The great thing about the PTTCs and the PTTC network is that we are under a cooperative agreement with SAMHSA as opposed to a contract. If there's a topic that is bubbling up for us, and we do annual and sometimes more frequently needs assessments of our workforce to know what to produce, what the demand is. But if something's coming up for you and you're not really finding exactly what you need, again, I'd encourage you to reach out to your regional PTTC and just explore that with them. It might be something that they're hearing many other places. Obviously, the opioid epidemic is everywhere right now. We're doing a lot on that. And we have, I'll just put a plug out there for an issue brief that we are publishing, I believe, early in the year about the distribution of the opioid funds across the United States. So keep an eye out for that.
Great, thank you, Van. Let's see, another question here. Denise, could we do, how do we ensure that we receive the invitation or subscribe to our newsletter?
Sure. So to subscribe to the newsletter, if you go on the Communities Talk website or stopalcoholabuse.gov, there's a subscribe button on the top right hand corner. If you click on the subscribe, then you'll be listed to receive our e-alerts. And what was the second question, Marian? Was there a second question to that?
No, That
You
that was
sure?
it.
Okay, not a problem.
Let's see. Another question is, we can't wait until we receive the email invitation. So yeah, at this point, until you receive the email invitation, and the cycle begins it's open on January 3rd. That's when the process will start. Another question, Kate, you said to clarify, this is for alcohol-specific prevention projects. So initially, Communities Talk was for underage drinking prevention, but since it began back in 2006 and we've seen it evolve, those conversations expanded beyond underage drinking to include topics such as marijuana, opioids, fentanyl, suicide, and suicide prevention. So that is how we expanded what I call the conversation of Communities Talk. It grew from just underage prevention because we try to be in line with SAMHSA's mission and vision of what communities are talking about. And as we listened from year to year, we saw that underage drinking was a main topic, but they were also talking about other substances in addition or with alcohol. And so we wanted to open it up so that communities are having conversations that are germane to what's happening locally. See another question here. Could a stipend be used to purchase materials that can be used for multiple activities, i.e. banners, signs, swag, to use at events we coordinate, such as project graduation, town hall meetings, sign waving events, youth coalition recruitment events, etc. So the short and easy answer to that is yes. However, I would say please go to the frequently asked questions or the FAQs on the Communities Talk website to see what stipends can and cannot cover. Denise, do you want to jump in and say something in addition to that?
No, Marion, you covered it. We do have a list of things that are permitted and prohibited as it relates to the Communities Talk stipend, and it is on the FAQs.
Okay. I'm trying to find another question related to the PTTCs. Okay, this one is from Jasmine. This might be one for Van. Do you have any resources for families trapped in the trenches without resources, real role models, mentors, doing the impossible with nothing? We are often blamed, marginalized, and stigmatized and feel abandoned. Where's the place for us? Can we serve on committees, advisory committees, so that we impart trench knowledge and assist with cultural humility?
Firstly, I'd love to just commiserate as a father of 2 young boys over the pandemic, a 5-year-old and a 2-year-old. I feel you. And there's not much space for anything else. One of the reasons why I think probably many of us are in this field is because so much of prevention happens at the family level. Many of our resources, many of the evidence-based programs that we promote are focused. That is the focused population, is the family or the parents, via an avenue or just direct service delivery. So I'm confident that the field of prevention at large and the PTTC network has a lot of good resources for parents. But as you describe, I believe so accurately, the trouble is often just getting them involved, getting the resources in their hands. And I know that a lot of our local coalition efforts, partnership efforts across the United States, I'm thinking of the host of other SAMHSA grantees here, have that within their scope, addressing the needs of families and getting them involved. As a population, though, I think it's an interesting thought to include them amongst the list of identities that we include in our work, either through like stakeholder engagement, the classical term, or participation on our advisory board. So just personally, I think that, yeah, there's room to expand that conversation.
Thanks, Van. See if I understand your question here, Hunter. For the registration for the community talk stipend, what time will the registration begin on January 3rd? January 3rd is the first day of the working business day, since Monday is the holiday for us. So I would check in, hopefully we'll have that up. I'm thinking, I would like to say 9 o'clock, but hopefully no later than noon on January 3rd.
Great answer.
Bailey asked the question, does an individual organization have the ability to submit more than one application with the same EIN and W-9 information? For example, can one physical agent supporting multiple community coalitions help each coalition apply? Or is the physical agent confined to one application?
Great question. I can definitely chime in, Marion, and answer that. And we also receive, Elizabeth, I also saw your email as well. Very similar question as it relates to the umbrella agreements with national organizations. So yes, a physical agent can submit a list of local or state chapters or contacts for each organization underneath their umbrella. However, one thing that it is important to know is that they cannot combine their stipends, right? So we cannot have A organization and B organization combine the $750 to hold one event. They have to be serving two different communities. So that is what is very much important. And then we can use that one W-9 to kind of support all the local or the state chapters, but again, they have to be hosting their own communities talk activity within their own community. And just know that the check will be mailed to the address on the W-9. So it will be your physical agent or that national organization responsibility to make sure that they pass down the funds to the local chapters. So again, we typically mail to the addresses on the W-9, and then that physical agent or that national organization will then filter down the funds to the local and state chapters. Hopefully that answers the question. And thank you again. That was a great question. We get that all the time.
Let's see. Pardon me, guys, trying to navigate this, the chat box and the Q&A. It's getting a tad interesting. So Kendall asks, can we use this to develop videos for social media campaigns? The answer is yes. We've had people to use the stipend to create, those billboards that you see on the highways. People have used them to hold in-person events. So yes, there are, yes, the answer is yes, you can use that to develop videos for social media. Let's see, I'm trying to be cognizant of time, and at this point, I think I should go to slide 32 and do a little housekeeping. On this slide is our contact information. So if you have any questions, which if you're like me, you think of a question that came up that you didn't have a chance to ask, or a question that we didn't have a chance to answer, you can send that to the info@stopalcoholabuse.net box, and we will respond to that. Also, I want to, did I do the slide about slide 32, which is the stopalcoholabuse.gov? Yes. So please visit our website to learn more. Any questions can be directed to the email on the screen. Also, I would be remiss if I didn't talk about an event that is happening very soon, which is save the date for SAMHSA's 19th Prevention Day. Is going to be held in conjunction, excuse me, with CACA and take place on Monday, January 30th, 2023 at the Gaylord National Resort and Convention Center in Oxon Hill. Please make sure that you register today. Van, I don't know if I'm pretty sure the PTTCs will have a presence there. Shameless plug on my part. We're doing a session during Prevention Day on youth-related in regards to prevention, and during the CACA conference on Tuesday, we're doing a session on intersectionality. Please, if you plan to attend, look us up and come to those sessions. At this point, I will say thank you to our speakers, Denise and Van, and thank you to all of you for joining us. We wish you a safe and healthy holiday season. Thanks again.